Let me just get everything. Okay, excellent. And everyone can see my screen. I've got to ask our favorite question.
Yes,
Okay,
looks great.
wonderful, excellent. Thank you. So a little bit about me. I'm an assistant professor of medicine at Cedars-Sinai Medical Center and also hold an adjunct appointment at the UCLA Fielding School of Public Health. My research really focuses on trying to understand, what are the various factors, whether, different, reasons that influence kind of high risk medication use in older adults. So, for example, I've done research examining the use and overprescribing of opioids. Another project that I'm working on is focused on the overprescribing of benzodiazepines, and I'll be talking a little bit about the overprescribing of antipsychotics. I have a particular, as a Latinx woman, I have a particular interest in studying kind of low value care, or care that we think of as unnecessary, potentially harmful in minority populations, particularly the Latino community. So I will be talking a little bit about this project. I'll be talking about this project today. So a little bit of background for those of you who may not be very familiar with antipsychotics. Antipsychotics are psychoactive medications. They are prescribed off-label. In other words, they're not specifically approved by the FDA for this reason, and they're prescribed to reduce the intensity of certain symptoms in dementia care. So oftentimes people with dementia or Alzheimer's disease may experience anxiety, agitation, and some aggressive behaviors, and antipsychotics are prescribed off-label for these reasons. However, they also come with significant risks, including risks of falls, cardiovascular risks such as stroke, blood clots, and heart attacks, and they also come with increased risk of mortality. As a result, as part of the Choosing Wisely campaign, which is really a campaign focused on trying to reduce unnecessary or potentially harmful care, the American Geriatric Society and the American Psychiatric Association specifically recommend that antipsychotics not be used as the first choice to treat behavioral and psychological symptoms of dementia. What is really quite concerning is, although we see kind of lower rates of preventive care, really helpful care in the Latino population. So for example, lower rates of various types of cancer screenings or flu or vaccinations. Unfortunately, this is one area where we actually see an overuse of care. We find that Latino older adults compared to their white counterparts are more likely to receive antipsychotic medications for dementia. So this particular study published in 2015 actually found that Latino older adults had a 1.62-fold greater use of antipsychotics compared to non-Latino whites. And some studies have tried to kind of unpack the reasons why this may be the case. It could be that, greater dementia severity earlier in life could be resulting in this overprescription, but it's really not well understood. And whenever we're trying to reduce the overprescribing or overuse of any particular harmful medication or service, really understanding why this is happening is absolutely critical, which really leads us to start to kind of think about who are the various kind of decision makers that lead individuals to kind of receive these medications. So we might think about obviously the clinicians who might be doing the prescribing, the older adult who has cognitive impairment, dementia or Alzheimer's disease, and the caregiver or family members who might be caring for this individual. So the focus of this study really is caregivers. And I wanted to focus on caregivers because we know that they play an incredibly important role in caring for individuals with dementia. They may be the ones, and when I say caregivers, it could be one primary caregiver, or it could be a family who might be caring for the person, who are helping, to really navigate, as we know how challenging that can be, the healthcare system interfacing with multiple medical providers. They might be making decisions about the kinds of medications that that person might need, not just for treating their dementia, but it could be for any other healthcare conditions that they might be managing. Also might be providing assistance with personal care activities of daily living. And as I mentioned, it could be really managing the behavioral symptoms that are associated often with dementia, such as distress, confusion, and occasional aggression in that individual. So there have been a variety of interventions that have been developed to reduce antipsychotics among older adults. But interestingly, we've seen really very little research in focusing on the Latino population. Most of these studies have focused primarily on white caregivers. Why is it important to focus on this particular population? We know that there are really critical structural issues that may affect the receipt of healthcare or individual access to healthcare for Latino older adults and their caregivers. And specifically, I focused on important discussions. It could be language barriers, health literacy barriers that could impede important discussions about medication use between Latino older adults and caregivers and their medical providers that could be potentially leading to some of the challenges there's some of the overprescribing that we're seeing among Latino older adults. We also know the Latino older adults experience long delays to dementia diagnosis. Again, structural factors play a very important role: lack of access to regular healthcare, financial issues, transportation issues. We also know that, as with many communities, this is definitely not unique to the Latino population. There is a stigma associated with dementia, and there might be a family, it might take a longer to accept a diagnosis. But as I mentioned, definitely not unique to the Latino population. And then lastly, I wanted to talk a little bit about, caregivers, some research has really shown that Latino caregivers may be less likely to have formal sources of support. So, maybe less likely to maybe join formal caregiving groups, such as those hosted by the Alzheimer's Association or by other kind of community providers, and in general kind of receive more informal support from family and friends. But overall, primarily Latina caregivers may experience more mental health consequences such as anxiety and depression. So all that to say, so the objective of this study was really to survey and describe and really focus on caregivers, really try to understand the perceptions and use of antipsychotics among Latino caregivers of persons with dementia, really to try to understand what role they may be playing in terms of the conversations, for example, that they may have with providers about these medications, their understanding of what these medications do and the risks and benefits, and also trying to assess their understanding of how, what are other alternatives that could be potentially useful for managing these behavioral symptoms. So the long-term goal of this research is really to develop and test and evaluate some resources that could help engage caregivers in advocating for the decreased use of antipsychotics. We know from interventions focused on other types of low-value care that engaging caregivers is absolutely critical and really can make a difference in the health and quality of life of persons with dementia. So for this particular study, I'll be using a qualitative research design, and we'll be conducting phone or video interviews with Latina caregivers. I'm aiming to interview about 30 primary caregivers, so caregivers who are really consider themselves the main source of caregiving for the person with dementia. Also, I'm very curious in terms of trying to understand what kind of sources of support, and as I mentioned, it could be, support group leaders who are maybe more formal sources of support or promotoras, but to try to understand how information about antipsychotics is disseminated. And so interviewing key informants of leaders of support groups, as I mentioned, or promotoras. And then we're partnering with a variety of community organizations for recruitment. So I am working with some individuals at Alzheimer's Los Angeles, and also working to, and I want to just do a short shout out to Carmen Reyes here, who has just been absolutely fantastic in connecting me to other organizations around the Los Angeles area in terms of for recruitment. So in terms of really, I want to highlight a few things that we'll be covering during the interview guide. As I mentioned, really trying to understand kind of the current management of behavioral symptoms for dementia. So the knowledge and, trying to assess caregivers' knowledge and risks and benefits of antipsychotics, what discussions they may have had with a care team, whether that's a physician, nursing staff, social workers, about antipsychotics or behavioral symptoms. Um, and also kind of more broadly trying to understand caregivers' knowledge and attitudes and benefits about dementia. We've been quite careful in our recruiting materials actually to not necessarily use the terms dementia, because that's actually not necessarily a word that people might be very familiar with. So we're recruiting individuals who are caring for somebody with memory issues. And I see I have 1 minute left. Thank you, Christina and Art. And lastly, really want to understand where individuals are getting information about medications and other healthcare services for dementia, as that can really help us think about, what would might be the best targets for an intervention, whether that might be, if they're getting it from medical providers or the media or other sources of information. Last couple of notes, our interview guide for support group leaders and promotoras will again kind of focus on where are those who are teaching and supporting others receiving information about medications and other healthcare services. If they have discussions about behavioral strategy, about how to manage behavioral issues, whether antipsychotics come up during these discussions. If they do, what are some of the conversations around these medications? I wanted to thank a very large group of individuals. It really takes a village to put these studies together. My mentors, Dr. Catherine Sarkeesian, Dr. Tara Knuckles, Dr. Joshua Pevnik, my co-investigators on the study, Dr. Allison Mays, Sarah McCluskey, the wonderful Rick Martime staff and program directors. And I've also listed a variety of individuals at various senior centers and adult day cancer centers who are helping me recruit for the study during COVID, which is quite challenging as many facilities have closed, but I'm happy to report that we have begun recruitment for the study, which is excellent. So with that, I am happy to take any questions, and I've also left my email if you would like to email me with any questions after the talk.